So here is diagnosis, what we're talking about. So today ICD-10-CM has to do with diagnosis. So you can remember ICD, D for disease or for diagnosis. And then when we talk about CPT, CP is current procedure, so P is for procedure or what was done to the patient. Now, the last word says coding. So coding is when we're going to change a word, a term, or something into a code. So we're going to show you the format of this code. It's a really complicated one if you see it for the first time. CPTs and HCPCS are going to be a lot simpler. Modifiers are going to be extremely simple. So, but when we start with ICD, because you're seeing it for the first time and you might not know what it is, and it becomes kind of complicated. Not something that has stopped us from learning it or teaching it in the past. So hopefully you'll be the next group that gets it properly. So when we say coding, we use different formats. So for example, if I were to say date of birth, for example, so if I was saying date of birth, the format that we use is a 8-digit, 1, 2, 3, 4, 5, 6, 7, 8. So 8-digit format. So that means that we're gonna need 8 numbers or letters, in this case numbers, because date of birth is numeric. And then you're gonna have, for example, for today's date, that is 10/12. So you're gonna have 10, 12, 2024. Okay. So that's that that thing that I wrote there is code for today's date. Okay. So in a date format, it's numeric and it uses 8 digits. Okay. So that means that we have 2 for the month, 2 for the day, and for the year we use 4. Okay. So that is coding, okay, for a date. Instead of saying October 12, 20, so the whole thing, the 12th of October of the year 2024, we could write it down in a sequence of numbers that we can interpret as that's a date. So we're doing the same thing with diagnosis. So heart attack, high blood pressure, diabetes, or even something more complicated than that, we're gonna change it into a set of codes that are gonna be in a specific format, and anyone that can see that can understand what it is, or anyone that has knowledge of what the codes are. If I show you that number 10, 12, 20, 24, immediately, because of common knowledge, you know that that's a date in a long format, only using numbers. We have other codes. We have the NPI, for example. The NPI is for the provider, and that's going to be a 10-digit. 10-digit, all numbers. So 10-digit numeric format to do this. In ICD, the format is a lot different. ICD has many different ways to do it. You could have up to 7 characters. There's going to be 1, 2, 3. Then you're going to place a dot, and then 1, 2, 3, 4. So we have 1, 2, 3, 4, 5, 6, 7. The first number is going to be what we call alpha. So that has to be a letter. And the rest of the numbers are the rest of the characters could be numbers. Except the last one that is going to be alpha again. So we have numbers in the middle of letters. So the first, always the first is going to be a number. I mean a letter. And then after that, the next 5 are going to be numbers. There's some instances that they could be a letter, but it's not necessarily a letter. It's a placeholder. We're going to show you later. And the last one is going to be a letter. Not all the ICD codes have all 7 characters. The minimum will be 3. So you can have a code that has 3 characters, and that's going to be an actual code. An example will be if I say letter I-10. I-10 is the ICD code for hypertension. Okay. But if it's hypertension with something else, then it will have more characters to make it more specific. This will make a lot more sense when we start practicing, but for now, just know that ICD-10, it's alphanumeric, meaning that it has numbers and letters. It's not multi-axial, so it's something we're going to show later. Some things are multi-axial. Multi-axial means that each character could be either a letter or a number. This is not multi-axial. This is single axial, one letter or one number, and in the specific ones. That multi-axial, I'm telling you in advance, because when we do the HCPCS and the CPTs, we can differentiate HCPCS and CPTs if they start or end with a letter. So CPTs are only numbers, and HCPCS are numbers or letters. So that will make sense as we move forward. So ICD-10, like I said, it's International Classification of Disease, the 10th book. ICD-10-CM is what we use in the US. So sometimes I tell the students, remember CM, think about TMS, and then you know that ICD-10-CM is what we use in the US. If I say ICD, if I say ICD-10, if I say ICD-10-CM, I'm talking about the same thing, just so you know, okay? In the US, we use ICD-10-CM, so everyone says ICD, ICD-10, or ICD-10-CM, and they mean exactly the same thing. So we're gonna talk about what is ICD-10, the 2 sections that ICD-10 has. So ICD-10 has the CM and the PCS. The CM is for diagnosis, that's the one that we care about for this class. This P is for procedure. So you need to know that ICD for ICD-10 PCS for inpatient hospitals. So inpatient hospitals, we use ICD-10 PCS. So that is not something that we cover in these classes. So ICD-10 PCS is, you need to know that it exists, and you need to know that that's for procedures. The P should tell you that it's for procedures, and it's for inpatients. Okay, so that means that when you are in a hospital, you're gonna have a combination of ICD-10 for the diagnosis and for the procedure. ICD-10-CM for the diagnosis, ICD-10 PCS for the procedure. ICD-10-CM for diagnosis is for inpatient or outpatient. So it doesn't matter the patient, they will get ICD-10-CM. The ICD is divided into an index. The index is one of the most important parts of the book. When I say the book, it's the book that you're gonna get from whatever publisher it is. It is published the same way. So the books are gonna have a different, for example, a different face to them, a different binding, but the information that's gonna be there is gonna be exactly the same, in the exact same way. So if I wanted to print the book, and I could put on cover, I could put my face on the cover and put ICD-10-CM with permission of the international committee from the World Health Organization. I could do it, but the information that is in has to be exactly the same. So the index is your best friends. It's your best friend for this book, and it's gonna be your best friend for every other book that we use. What do I mean? What I mean is that when you're looking for something, you need to start at the index. There's no other way. There is other ways, but the easiest way to do it for you guys and for everyone is to do it through the index. So the index is going to be your best friend for every single book. You take the book and you're looking for a code, you're gonna go to the index. That is my suggestion, and that's how I'm going to show you when you have your books how to do it. Okay. You look for the term, or I give you the term, or a question gives you the term. You look for it in the index. From the index, you go to a tabular list. So the tabular list is a list that we have in what we call chronological order, because I said that every single code starts with a letter, with an alpha. So you're gonna look at that one, and those are gonna be in alphabetical order. So first the A's, then the B's, then the C's, then the D's, whatever it is. Okay. So that is alphabetical order. But I didn't say alphabetical order, I said chronological order. Chronological order includes both, right? The alpha plus the numbers. Okay. So the numbers are also going to be taken into account in this order. So if I say I have A00, that will be my first code, then the code that is going to be after that one could have another 0. So it could be A00.0. And the one after that one could be, again, it could have more zeros, more numbers, or this could be A00.1. So that one goes before that one, because that one has a 1 there. Okay. Now let's say there's no more codes until A00, 01. Well, A01, you look at that number, and you look at that number. Which one goes first? Well, the 0 goes first, the 1 goes second. And then you can keep going. A10. Okay, A10. Then you look at the first number, that it's 01. The other one is 10. Goes after. Then it could be B00, the next one. Or it could be B00.0. You'll see that it's a list, and they are in that order. So when you're looking for a code, for a specific code, you need to know where to find it in the index first. Then the index will give you a number, and how do you check for those numbers? So the tabular list is a whole list of every single code in what we call chronological order. So we call them chapters or sections. The books, some books are chapters, some books are sections. So let's say you have a chapter or a section with the A's. All the A's is going to be in one. All the B's are going to be in another one. All the C's are going to be in another one. Okay. So that's how you go from it. And I'll show you how to pass pages until you get the actual codes. There's official guidelines that are going to be in each one of the chapters or the sections, and there's going to be conventions. We're going to show you what that means. And then some diagnostic reporting for outpatients, because that's what we're looking for ICD-10-CM. ICD-10-CM, inpatient or outpatient diagnostic coding. Okay, diagnostic. If we were talking about procedures, it will be ICD-10 PCS, and this is for inpatient. Okay. Now, like I said, ICD-10-CM, it's reported for all diagnoses, regardless of the setting where we are. So if we are inpatient in the hospital, if we are outpatient, if we are, it doesn't really matter. So physicians' offices, clinics, outpatient care, standalone clinics, home health, hospice, hospitals, long-term skilled nursing facilities, everyone uses ICD-10-CM. Everyone that is a provider that is going to provide services to patients, and they're going to bill for that, they're going to use ICD-10-CM. Every single provider is going to do that. So ICD-10-CM for every single practice. ICD-10-PCS is only for inpatient hospital. Okay. After that, in the next two chapters, we're going to cover CPT and HCPCS. Okay. CPT is for procedure, HCPCS is for supplies. That's the best, easiest way that I can describe this. So if it's something that we do to a patient, it's going to be a procedure. This is something that we give the patient, like a wheelchair, like some medication, like oxygen, a machine, a bed. That's going to be supplies, or HCPCS. We call them HCPCS because of the way they sound when you kind of look at it. So HCPCS. So what has the money attached to it is a CPT or the HCPCS, but they have to be accompanied by an ICD-10 CM in order to get paid. A long time ago, we had ICD-9. This is just to tell you a little bit of the history. I do not care about this because nobody's gonna ever ask you about this. This is, more than 10 years old, more than 10 years gone. Okay, like 40 years old. It's been gone for 10 years. But office and clinics, this is outpatient. Okay. Hospital inpatient, this is inpatient. And then a hospital can also have outpatient. So this first one is hospital, and this one is hospital too, right? Hospital. If we are in the outpatient setting, doesn't matter what outpatient setting is, it could be the doctor's office or it could be the hospital. So both of them outpatients are going to use ICD-10 CM, CPTs, and HCPCS. So ICD-10 CM, CPTs, and HCPCS. The only one that is going to use ICD-10 CM and ICD-10 PCS is inpatient hospitals. That is something that whenever we cover all of the books, so next week when we do CPT and HCPCS, we'll compare which one goes where. But it's simple. If you're in the outpatient setting, it's going to be ICD-10, CM, HCPCS, and CPTs. If you are in the inpatient, ICD-10 CM, because everyone uses ICD-10 CM. But now we're going to use ICD-10 PCS for the procedures. So kind of the same thing. I divided it already, but ICD by itself, they don't have it here, but ICD is just the international classification of morbidity and mortality. That means that is the why someone is sick or someone died. So that's how ICD started, saying mortality. What was the cause of death? Then they added morbidity, what's causing the problem. Then ICD-10, then again, is published by the World Health Organization and classifies mortality in death certificate or for death certificates. In the US, we added the CM part, so ICD-10 CM, and then technically we say now it's not only mortality, it's mortality and morbidity. So what killed the patient and what was the problem? Now, the word morbidity is disease, and I want you to understand that ICD-10, even though it's disease or death, it's better described as diagnosis. I'll give you an example. Diagnosis is for diagnosis does not have to be something bad. Okay, you can have a diagnosis of pregnancy. That is not a disease. That is not a cause of death. This is an example of or a description of the state of the patient. When you take your baby to the hospital, not to the hospital, to the doctor's office for a wellness checkup, if they don't find anything wrong with the baby, we are going to use the diagnosis, the ICD-10 CM diagnosis of healthy baby. Okay, so healthy baby visit, diagnosis for that is healthy baby. Okay, so that is not a disease. It's just a diagnosis, a description of the state of the patient. So ICD by itself has to do with the World Health Organization. ICD-10 CM has to do with CMS, has to do with the United States of America. ICD-10 PCS is again CMS. You see what CMS is. This also has to do with CMS a little bit. ICD-10 PCS is for procedures. You are not going to be asked any of these codes on your exam. So we're gonna focus on ICD-10-TM. Now we're gonna mention it just in case, just so you know to differentiate it. So again, anything that we do, it has to do with CMS. So CMS has this for inpatient settings only. It's a multi-axial. So this is what we said before. Multi-axial means, so it's multi-axial 7 characters. So 1, 2, 3, 4, 5, 6, 7. So 7 spaces that we could put letters or numbers because it's alphanumeric. Okay, alphanumeric means alpha letters, numeric numbers, so numbers and letters, right? But it's the multi-axial, so that means that each one of them could be either or. It could be a letter, or it could be a letter or a number. Now that makes it really, really big in the way that we can put any number, any letter, or any combination of numbers and letters through 7 characters. That's gonna make it, you know, extremely, extremely big. So you can have many, many thousands of codes with one system. So as of right now, we're talking about 87,000 alphanumeric procedure codes. That's only for the ICD-10 PCS. Okay. For simplicity, we're not gonna count them, and then we're gonna bring it to 100,000. That's in between ICD, CPT, and HCPCS. So if we were including all of them, we'll be closer to 200,000 codes. So yeah, there's many, many, many codes. So just know ICD-10 PCS for procedures in an inpatient setting. The patient has to be in the hospital as inpatient. So the difference between inpatient and outpatient is that the patient stays in the hospital over 24 hours. So if the patient is admitted to the hospital, that counts as admitted. The plan will be for that patient to stay more than 24 hours. If the patient stays over 24 hours in the ER or something like that, immediately the patient is going to be admitted to the hospital in most cases. So any stay longer than 23 hours, the way that they do it, going into 24, that will be an admission to the hospital, or the patient is admitted to the hospital as an inpatient. Just because you go to the hospital and see your doctor that has an office inside the hospital, that doesn't make you an inpatient. Just because you get surgery in the hospital, if it's an outpatient surgery that you take to do the surgery and then you go home the same day, then that is not inpatient. So you need to identify first what we are actually saying. Now, the manuals are gonna be printed, and they're gonna be printed every year. I'll explain why. For a long time, I've been doing this class, a long, long time, and I've never had something to. I did had examples. It's kind of the same example that I'm gonna do now, but right now, it's something that makes sense and everyone understands. For a long time, people didn't understand that this could be a thing. So why do we have to print the book, or why do we have to change the book or the codes every year? So, I would say, well, new things can come up. For example, for new procedures, new technology, new techniques. So we will have to change the CPT book, every year, because something new, a new kit of technology or a new whatever. But it was harder to comprehend that the diagnosis could change, because a headache is a headache, a heart attack is a heart attack. Since humans have been in this earth, they've had heart attacks. So go, I don't know, 1,000 years ago, and then people died, and we didn't know exactly what it was, but now we know that, it could have been a heart attack. You go back. So these things are not new. Heart attacks are not new. Cancer is not new. The flu is not new. Like all those things are not new. These are things that we've had since forever. So it was hard to understand that a new thing can come up and then had to be added to the book. Okay, as a new diagnosis. What is new? Like everything that's here is here. Well, we gave an example. Some new thing can come about and should be added to the book. Well, now I can use that example perfectly fine. In 2019, the end of 2019, around November of 2019, COVID started. So COVID-19, that's where the name comes from. COVID-19. It started at the end of 2019. So the book that was printed for 2020 was printed before COVID actually started. So the 2020 book and every book before the 2020s did not have COVID-19. That's a perfect example. So the books moving forward had to include COVID-19 as a diagnosis. And then the same thing happened with the CPT book. The CPT book did not have a treatment for COVID-19. The HCPCS book did not have the test for COVID-19. So we had to change the books as new things appear, or we reclassify things. So it is extremely interesting how we can add things to the book, and we can add things every year if things change, if something new comes about, if a cure for a disease is found, vaccination for something is found, or any new treatment. So that's why the book is updated, and it's updated every year. Now, imagine that the changes are not going to be that much. Okay, there's a bunch of codes, and we're not going to add, thousands and thousands of codes every year. No, we're just going to add a few codes. We're going to change a few descriptions. We're going to, and the changes are minimal compared to the amount of codes that we have. So publishers are going to print the books. Different publishers, they're going to print it in whatever way they want. So I have different. Let me give you examples here. I don't know exactly which is the one that you're gonna get, but for example, this is, there you go. Optum is a publisher and prints a book. This is an example of the HCPCS Level 2 book. But the information that is inside is in the same format, and the same colors, and the same thing that any other publisher that could print it. I have this one that is from the American Medical Association, and this is a CPT, and this has a ring bind. It is floppy. It's not like a hardcover, but the information that is inside and the colors is exactly the same. And then I have all the ones that are from the other companies, Optum, and they are exactly like the first one that I gave you. They don't have the rings. They just have different ways of doing it. But the information and the things that they put in is exactly the same because everyone has to use the same. So they are publishing in a single volume, so one volume for each one. So one for the CMS, for the 10 TM, and one for the 10 PCS. The same for the CPT, one book for the CPT, one book for the HCPCS. You guys should get 3 books, CPT, HCPCS, and ICD-10. So the one that we're talking about is the CMS has the what we call the whole manual, has an index, has tables, has the list, and has some. Oh, they always have some extra things. I will show you how to work with the index first. From the index, go to the tables, or what we call the chapters or the sections. Tables for neoplasm or for cancers are extremely handy, and table for drugs and chemicals. So if a patient has a specific type of cancer, it's easier to look for that cancer in the table because everything is, formatted in a simpler way. If anyone has an intoxication with any drug or chemical, we're gonna go to our table. So I'm gonna show you the tricks on how to navigate through the book as easy as possible. Now, the ICD book, yours might look a little bit different, but ICD-10, and mine is 2023. You should have the 2024 version of it. The 2025 is not out yet. It is a thick boy. It is a really big book, and it has thousands of codes in it. The day of the exam, you will have to use the book or a version of the book. It could be what we call the online digital version of the book. It's going to be embedded on your exam. You need to understand how to navigate through the book, how to look inside the book, because that means that you understand the process of looking for a code. In real life, you have what we call computer assisted coding, or software that's going to help you get the codes without searching for them, without going through a book or through a database. So essentially what it's saying is that you need to know how to get the books. I'm going to get the codes from the books. Okay. The way that I like to describe this books is like a dictionary. If I gave you a dictionary, and a dictionary in any language, can you get the definition of a word, or maybe a translation, a translator? It could be. Maybe a dictionary is easier. If I give you a dictionary and I tell you, can you find the definition of this word? Can you do that? Well, yes. You take the word, and you know how the dictionary is set up. It is set up in alphabetical order. So you just go past the pages and look for the pages that have the letters or the first letter of your word, and then you scroll down alphabetical order and look for your word. So that's kind of what we're doing here. We know how the format of the book is, and then we search in the index. From the index, we go to where the page that the book is telling us. So hopefully you will be able to do this really, really simple. Now, like I said, luckily for you, there's software that's going to help you with this as part of the electronic health record or medical record. There's a few ways that they do it. Most of it, you are going to find the codes that you need to, or the terms that you need to code for in the index. So the software will show you what the ICD, CPT, HCPCS could be, and then highlighter or clicking on the ones that you want. Then that's going to be super simple. Then it's going to do it, you send it to the forms or send it to a software that's going to create the form. This is a lot easier than what it looks. When we start looking at the books, you're going to go crazy. You're like, oh my God, how I want to get this. You'll see that it's simple. We're going to get it done here, and then you're going to learn how to do it really good. So when we ended up doing it on a computer, it makes sense. Now, remember this? Remember HIPAA? We mentioned HIPAA before. HIPAA is the Health Insurance Portability and Accountability Act of 1996, passed by Congress. And one of the sections is the administrative simplifications. So we said that things have to be, or we wanted things to be simpler. And in order to make it simpler, we said everyone is going to use the same thing. Everyone's going to use a set of codes. And we're going to mandate that the use of those codes by law. And again, it's HIPAA. The the set of codes that we decided on were going to be ICD-10-CM and ICD-10-PCS for inpatients and for outpatient hospital. We also said that we're going to use CPTs and HCPCS to charge for what we're doing. So I like to explain here. Again, I'm going to do a little, I haven't done one of these ones in a while. Blackboard here. Right. Okay. We're talking about the ICD, okay? The ICD 10-CM is what the patient has, okay? So we're going to do something to the patient, and that something that we're going to do is going to be the CPT. So if we have an ICD 10-CM plus a CPT, maybe if I do it backwards, it makes more sense. I want you to copy. If you copy, I don't like to copy, I'm taking pictures. I want to do it like this. So CPT is a procedure, right? It's what we do to the patient. And we're going to add an ICD 10-CM, and that's what's wrong with the patient, okay? And if those two match, we're going to have money. We're going to have payment, okay? So the way that I want to describe it is, what are we doing to the patient? What are we doing to the patient? We're doing an evaluation, we're doing a surgery, we're doing an x-ray, we're doing anything else. And the second part is, why? Why are we doing that to the patient? So we have a what, that is the CPT, and we have a why, that is the ICD. And if we do that properly, we have money. The other way that you can see it is a procedure. A procedure is what we do to the patient. A procedure is a CPT. So if we do a procedure and we add a Y or an ICD or a diagnosis, we're going to have money. Okay? The what and the why. Now, the thing that has the money is this, or the thing that is attached to the money is a CPT. It's a what? It's a procedure. Those have a fee, okay? The diagnosis is just accompanying that, because you cannot do something that is not necessary. So you say, what was done? This procedure, this CPT. Why? Well, because of this ICD or this diagnosis. You cannot have a what without a why. You won't have payment. You cannot have a why and then do nothing about it. There's no payment. So the payment is attached to this. The things that have a fee attached to it is going to be the what, it's going to be the CPT, it's going to be the procedure. Now, that doesn't mean that always we're going to have this. We're going to have a CPT and an ICD and payment. Well, we need to prove what we call medical necessity. And we mentioned that many times before. We're going to keep seeing this little by little. So medical necessity is the determination that the service, the procedure, the what, the CPT is necessary based on the why or diagnosis or ICD-10-CM. If there's no link between them, there's no medical necessity between them, then there's no payment. We already asked this in many ways. One of the examples was, if someone has a broken leg, do they need a wheelchair? And most of you said yes. But I said, what about if someone has a broken leg? Do they need a motor scooter to move around? And when we were talking, most of you said no. But then I said, well, what if that patient is 98 years old and it's, not able to move the wheelchair, it's not strong enough to move the wheelchair. Well, they might need a scooter. And you're like, yep, you know what? Yep, it is a medical necessity for that patient to have it. But then if I change the patient and I say, well, this is an 18-year-old basketball player, you might say, no, they don't need a little motorized scooter. They could, they could use crutches. They could use a wheelchair if you need it. So we need to prove that what we're doing goes with what we are, uh, what the patient has. Again, the same example. If someone is pregnant, so you can say, well, that the patient is pregnant, so that is a diagnosis, pregnancy, and we do a C-section. Okay, those two things probably go together, and you can get payment. But not only just because you're pregnant, you're gonna get a C-section. So we need to prove that medical necessity. So just because two things go together, that doesn't mean that it's gonna get paid. And if they didn't go together, then nothing happens. So for example, if I say C-section, and then I say that the patient's what's the eraser? There you go. So C-section for a fracture. So the patient has a fracture. Okay. So the what? C-section, surgery. Why? Because the patient has a fracture. Those two things don't go together, then no money. So if things don't go together, they don't link. Okay, this is the important word here. Link. Payment might not be there. If the things don't go together for whatever reason, no payment. If the things are linked, go together, and there's no medical necessity, there's no payment. If they are linked and there is proven medical necessity, then yes, there's payment. Think about it like this. Let's say you walk into a place and you go like, what do they do here? They go like, well, we do X-rays. This is an X-ray. This is a diagnostic place. We do X-rays. And we do CTs, MRIs, and you go like, oh, I want one of those. I want an X-ray, a chest X-ray. There's no medical necessity for that chest X-ray other than the patient wanted it. So you cannot charge his or her insurance company for an X-ray because you have the what X-ray, but there's no why. Why? Just because the patient wants it, that is not medical necessary. So there's no pay. And the responsibility of proving medical necessity relies on the provider. The provider is the one saying, I'm doing this because of this. Now pay me. Basically, that's what they're saying. Your responsibility is to make sure that what the patient is getting and why the patient is getting it, they're linked. So when you send it, the doctor gets paid. And again, that's gonna come with practice, and there's software that's gonna help you with that to not get things wrong. For example, I think I mentioned this many times, so I'm gonna do it one more time. If you want to charge for a C-section, the patient has to be pregnant first. The patient has to be between the ages of pregnancy, 12 to 52. And the patient has to be a female. Okay? If I start with a patient that is a male, there's no way that I can get to C-section. If I start with a patient that is 98 years old, Could be a female, but there's no way I can get to C-section. If I have a female between the ages of 12 and 52 that is not pregnant, I cannot get to a C-section. So software coded already for these things. If you are a male, all of the pregnancy diagnosis, all of the procedures that have to do with female only or pregnancy only are not going to be available for you to pick. If the patient is 98 years old, pregnancy diagnosis will not be available. You cannot pick 98-year-old pregnant female. And you might think, well, those are simple examples that I understand. I will never make that mistake, but there's some other things that are closer together, and you might not know all the details about it. And if you choose the wrong one, you choose the wrong one. Simple as picking the wrong office visit. The office visits are separated by one number. If you pick the wrong one, you might not get paid. So there's software that's going to help you for this, but this is the essence of what medical necessity is. In your exam, they're going to ask you what is medical necessity, examples of medical necessity, interpret the medical necessity rule. It's going to be a lot of that. This is an example of a question. These questions are kind of weird sometimes, but this is a good one. We mentioned already subjective, objective, assessment, plan, SOAP note. So here the question says, Ms. Julia Vasquez, in anywhere medical clinic, anywhere USA, here's the date. Subjective. Subjective is something that is on the patient's own words, the patient's feelings, the patient's something that you cannot measure, something you cannot see. Says a 75-year-old patient with pain. So she's experiencing pain in her left hip. So subjective pain. You cannot measure pain. You cannot see pain. Objective things you can measure, things that you can see, things that you can get with machines. Says blood pressure reading 128/78, pulse 74, description of it regular, temperature 100.6. Examination of left hip reveals point tenderness in region of femur head. So they touch the hip and it hurts. Okay, that is objective. Now assessment. Assessment is going to be the diagnosis. What is the diagnosis? Left hip pain. From what the patient said and what the examination was, that is your diagnosis. Left hip pain. It says rule out thoracocenteric bursitis in the left. So another diagnosis that we need to make sure that it's not it. But here's diagnosis. Plan, or P for procedures. Well, what do? We did a left hip x-ray. That x-ray was negative for thoracenteric bursitis left. We gave a cortisone injection, or we will, to provide relief for left hip pain. And you go in the exam and you read all that question, and I go, oh my God, this is so hard. I don't know what I answered that question. Okay, let's do this. Question number 1 says, which type of code is assigned to, should see 4, 2 or 4, left hip pain? So left hip pain is what? A diagnosis, a procedure, or a supply? Well, left hip pain is a diagnosis. You should know that pain is a diagnosis. Also, you know that it's left hip pain is written down here in the assessment, and the assessment is where we write the diagnosis. So we know left hip pain is an assessment, left hip pain is then a diagnosis, and the ones that we use for diagnosis is ICD-10 CM. PCS is for procedures. So left hip pain is not a procedure. Number 2 says linking a code for left hip pain with left hip X-ray supports what? Well, supports medical necessity. Because we're proving that we needed, or we're showing that that to check the left hip pain, we're doing an X-ray. What are we doing? An X-ray. Why are we doing it? Because of pain. So that is medical necessity. We're going to go to the next page just to show you that we were correct. And then I'm going to show you a trick. Look at this. When you guys saw this question, how many of you were overwhelmed? How many of you thought that's too much? How would I answer that? Or maybe no one did, because you are amazing. No one.
I was.
Okay, let me show you a little trick. Can you answer that question number 1 if I eliminate a little bit of the top? Let's see. If I eliminate, let's do it in white. If I eliminate all of this, if I eliminate, let's say, subjective, can you answer the question? Well, the question says, what type of code is assigned for left hip pain? Oh, it's ICD. Okay, so I don't need the subjective information to answer that question. Okay, what if I take out the subjective and the objective information? Can you still answer that question? Well, assessment, left hip pain, ICD. Yes, you can. You don't need objective, subjective to answer that. What if I take out subjective, objective, and assessment from the question? And I give you only the plan. Can you answer which type of code is assigned for left hip pain? Well, yes. Okay. Left hip pain is a diagnosis, is ICD-10. So you don't need the subjective, objective assessment or plan. What if I take out the whole thing and I only give you the question, which type of code is assigned for left hip pain? Well, you can answer that question also. Pain, it will be nice if I do it in black so you can see it. Pain is a diagnosis. ICD-10 CM is for diagnosis. So all the crap that you have here, you need to answer that question, to answer any of those 2 questions. I can eliminate all of that extra stuff. I can eliminate, even the questions don't go with each other. So you can eliminate everything and you can still answer the questions by themselves. Linking of a code for left hip pain to left hip X-ray supports for necessity. So you don't need anything to answer that question. Now, you see a question like this, and you're like, this is going to take me 3 minutes to read. And you start thinking and you say, no. Just look at what the question is asking. You don't need all the things on the top. It's distractors. But the question is asking you a definition, technically. The question is saying, what is left hip pain? Oh, that's a diagnosis. You use for that diagnosis, you use ICD-10 CM. So that's how many of the questions are going to be in your exam. Embellishing them, putting a bunch of things. Make sure that you know what they're asking and you answer properly. Don't get scared of the questions. So before we move from ICD-9 to ICD-10, they were kind of making sure that things work properly. ICD-10 started in 2012-ish, 14. Actually before that. But in the US, it started its implementation in 2014. 2014. So 2014 started, got into law. People were using both of them at the same time, and by 15, everyone had to use it. So started probably at the beginning of 2010. It was got pushed and pushed and pushed until we actually fully started using it in 15. So there was what we call crosswalks to make sure that we could use codes that we used before now in the new one. The problem is that they are not equal. They are not. They were not working properly. So let me show you. And again, this is just for a little bit extra knowledge. You don't need to memorize or anything. The code for ICD-9 they were numeric only, and they had up to 5 characters. So it was a big difference because now these ones have letters, and they could be all the way up to 7 characters. So it was not a one-to-one. It was not a one-to-one mapping or matching of the thing, so it became a problem. But there were some ways that we could do it. So luckily for you guys, you will never have to see this ever in your life. So the ICD-10, like I said, ICD stands for International Classification of Disease, 10th revision, and the clinical modifications is the thing that has to do with the US. Okay, only the US uses this. This is our classification. It has an index, and the index is going to have what we call main terms, subterms, and qualifiers. It has tables for neoplasms and table for drugs and chemicals. An index for external cause of injury. So we're gonna check on all of those when we get the books. And like I said, neoplasms is cancer, and the table for drugs and chemicals is for toxicity. So intoxication with alcohol, intoxication with a medication, intoxication with uh, bleach, soaps, detergents, whatever. And then external cause of injury is what happens or what happened to the patient to get into that situation. So, for example, external cause of injury could be a car accident. So the patient has a broken leg because of a car accident. So broken leg is one diagnosis. The external cause of injury will be the car accident. Then in this book, we call them chapters. In this book, ICD-10-CM, we call them chapters. In the other book, the CPT, we call them sections. So in my class, I will call them chapters or sections for all of them. So whenever I say now you go first to the index, then we go to the sections or the chapters, I'm saying the same thing. Sections or chapters in my class, they mean the same. Then when we go to the chapters or the sections are going to be for the ICD, they're going to be in alphabetical order. So the A, the B, the C, whatever. And in the other books are going to be by. So if you see the CPT is going to be the ones, the twos, the threes, the fours. So what's the first character that starts the section or the chapter? In the ICD-10, because we start with letters, it's in alphabetical order. And then you'll see that things are divided into categories, subcategories, and then the actual codes that you can use. I'll give you an example here real quick. I think there's an example coming. Yes. Give me 1 second. Let me see if I can get the book real quick and show you something. show it to you in the computer then. So what I'm trying to do is I'm trying to set up a second camera that I have, and then with that second camera I can show you the actual book, but it looks super tiny, so we're not gonna do it today. We're gonna figure out something else. But I'll show you here. So when we go to the index, like I said, the index is in alphabetical order. So this is an example of the index. This is letter A for the index, and this is the first code in all the books. Why is that the first code? Because it's term that starts with an A, and the second letter is an A. So AA will be the first one. What will go after A, B? So AB. What will go after AB? So this one has AB, A, then an N. So this one has an A, B, A, and an S. So that one goes after. This one has an A, a B, and then a D. So that's how we go down the index. So index is completing alphabetical order. So what do you do with the index? Well, if you were looking for Arscott syndrome, that's the first one. Then you go to the index and you go like, I found it here. This is my option, okay? Q87.19. So you go like, now you go to the chapters where the Q87.19 is. And what chapter is going to be? Well, the chapter that starts with a Q. Okay, so you go to the chapter for Q, and then you start looking, it's going to start in Q00, and then you start going down until you get to Q87, and then 87.1, 87, and until you find it. Okay, so there's few options when we do this. You can look for a code, and it will give you, you can look for a term, and it will give you a code. That code is Q87.19. I also suggest you go to the chapters, look for that code, read. If it matches what I asked for or what the question asked for, then that's your answer. In the second example here, or the second word, says abandonment. So you look for abandonment, but then maybe the doctor used the word abandonment, and it tells you go to maltreatment. So instead of now looking for abandonment, you go to the index and you look for maltreatment. And then in maltreatment, you will have probably the codes. And again, the same thing in each one. So some codes are going to give you something like this. So let's say Q87.19. It could give you comma, for example, and then it could say, let's say Q87, I don't know, 0.30. And then comma Q something, 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 something. So when you have a comma in between them, that means that it could be this code or this code or this one. Okay. A different example could be that it says Q dash, Q87.9 dash Q87.30, the same, right? But now it means that it's every code that is in between those two. So you could have Q87.19, then Q87.20, then Q87.21, all the way to 30. So if it's dash, two numbers divided by or joined by a dash, that means that any number in between those, or any code in between those. And then you have to read the description for everyone to see which one matches what you're looking for. And it's fairly fast to do, so it's not like super complicated. But again, this will make a lot more sense when we start practicing. Luckily for you guys, the alphabetic listing has specific terms, abbreviations, all the descriptions. For example, I like this one that I like to show the students. It's called hangover. Hangover is what you get after a night of drinking. The next day you have a headache and everything hurts and you don't function properly. The correct term for a hangover is toxic effects of acute alcoholic intoxication. Okay, so the fancy name for it, it's all those words. But the word hangover is what we know and we understand as the toxic effects or the intoxication, the acute intoxication, or the toxic effects of the acute intoxication with alcohol, including hangover. So the book has the word, the book in the index has the word hangover. So you don't have to look for the fancy term. If the patient said hangover and the doctor wrote hangover, then you can get the actual proper code from the word hangover. Heart attack. Heart attack could be of many ways, but heart attack is a common word that we use. It's going to be there. But it could be the proper word could be, or the proper term could be ST. Okay, so ST segment elevation myocardial infarction. So that's a heart attack. ST segment elevation myocardial infarction. You can find it at STEMI. STEMI. So STEMI, STEMI, ST segment elevation myocardial infarction, or heart attack, all of those things mean the same thing. And all of those things are going to take you to the same code. In your book, it's in the index in your book has all of those. So it's really, really hard not to find something, even using lame terms. Okay. So that's how we're gonna do it. Let me show you the tables. Actually, not the tables. This is an example of how we get it. So let's say we want to say so the code here is this one. How did we get there? Well, it says admissions. Okay, admissions or encounter. So let's say encounter. Okay. For adjustment of an artificial arm complete. That's the whole thing. Okay. So if I'm looking for that, where would I start? Well, I'll start for encounter, for example. Okay. Encounter, so I go admission or admission for encounter. For what? For an adjustment. Well, admission for encounter for an adjustment. Of what? Of artificial arm. Artificial arm. And then complete. The last part, complete. So we start going down, making it more specific. An encounter for an adjustment does not include artificial arm. So it could take you somewhere else. Under that, you start going down and making more specific things. So that will actually, that's the best way to do that is practicing. So whenever we get our books, you'll see how that one works. If we get a cancer or neoplasm that we need to talk about, neoplasm is cancer. Neo means new. Plasm is formation of cells, so new formation of cells. And new formation of cells is tumor. Okay, so tumors are neoplasms. Not all tumors are cancer, but all cancers are tumors. So you should know that whenever we talk about neoplasm or cancer, there's a table that we will go to. The table is going to start everything in, again, alphabetical order. The first thing is abdomen, A, B, D, abdomen. And then after that, everything that is indented is that it's here in the middle. So indentation, it's like a tab in your computer. So anything that is in this line is going to be in alphabetical order. A, then B, then C. But anything that is in this line is going to be in their own alphabetical order. That's why it says cavity, then organ, then viscera, then wall. Okay. Now, if we move to another inside here, that's going to be in alphabetical order. This one also going to be in alphabetical order. This one's going to be in alphabetical order. So as we move in, each tab, each indentation is going to have their own alphabetical order. So cavity, organ, viscera, and wall are in the same line. So they're going to be in alphabetical order. If you go to this one, connective tissue and skin, they are in the same line, that's alphabetical order. But then you got, but there's a B. Well, because the B is indented, it's inside. So B, S, S, that's going to be in alphabetical order. So that's something that is the formatting of this books. So at the beginning could be a little bit complicated when you're looking at this, and you specifically when you're looking at the index. But you know, for now, it's I'm just mentioning it. Later we'll mention it again, and hopefully you get it. So let's say we have a cancer of the abdominal cavity. Well, you go to abdomen, you go to cavity, and then you have these options. All of these options, only these options. Okay. Nothing else, because everything else is for something else. So now we go to the top and we look, well, what type of cancer do we have? We're going to have a description. Is it malignant primary? Is it malignant secondary? Is it carcinoma in situ? Is this, if it's benign, this is kind of okay. Uncertain, unspecified. The description will tell you. If they don't say anything, it's going to be always malignant primary. So if I say neoplasm of the abdominal cavity, you go abdominal cavity, because I didn't say any is malignant, is that one. C, and sometimes you can remember C for cancer, C76.2. That is the code. Now you go to the chapters or the sections, the chapter that starts with a C, and you read C76.2, and if it matches what the description is, that's the one. If you have some other description that makes it more specific, then you go down to a more specific one. Let's say it said that it was malignant secondary. So malignant secondary for abdominal cavity is this one, C79.8 dash. So that means that more numbers are needed. So you go to C79.8 in your chapter, and then you keep going down to a more specific. Sometimes things are like bilateral or left or right, and so it gives you more descriptions. So that's kind of how we do this ones. Let's show you table of drugs and chemical. Same thing. If you were poisoning, if your patient was poisoned with anything, let's use the first one, 14-hydroxy dihydromorphinon. Jesus Christ. 14-hydroxy dihydromorphinon. That's I don't even know what that is, but it's a substance, it's a chemical, it's a drug, something. So let's say the patient had that in their system. So we need to determine what, why, right? So we look for the substance or for the drug, and then the only options that we have is all of these ones, right? These are all the options. Now we need to see if it's poisoning accidental or unintentional. If it's poisoning intentional, self-harm, the patient wanted to commit suicide. If it's assault, somebody forced that patient that chemical, or we don't know, or it's a medication that had an adverse effect, or it's an underdosing of a medication. Okay, all of those options. So let's say it's an unintentional poisoning. It's a kid found that the medication, the chemical, and accidentally got it. So T 40.2x1. This one has 6 digits, and one of the digits is an X. We're gonna show you what that means as a placeholder. That will make a lot more sense when we start practicing. Not everyone, not all the codes will have an X. Some will have 2 X's, 3 X's. It depends on the code. I will explain when we start the practices. But if I say something else, like I don't know, let's go here to Aceto Button, for example, well, these are the options, okay? And then you pick whichever it is, and you see that it changed. You just want one number. The thing changes by one number at the end. The last number is the one that changes. So if you get there, then you have to pick in between 4 or 5. You need to just read the descriptions here. You get it from here. You go to the chapter, confirm, and you tell me your final answer. For external cause of injury, it gets extremely specific. I like to show you this one because it's interesting. So what happened to the patient? Well, the patient was in an accident. Okay, so accident here is the option. So accident was in an aircraft with an animal drawn vehicle. You were an animal rider. You were in a horse. It was a car accident. Were you a barefoot water skier? Did you got hit by a boat? You were someone was swimming and a boat hit you. What type of boat hit you? A power boat or an unpowered boat? Did you get hit by a canoe? Did you get hit by a boat? Like it's super specific. Okay. So the example here says the patient was in a water transport accident. Let's say is this one. So it was a beta struck by a watercraft. And here, let's say it was this one. So V9 4.11. Swimmer got hit by a boat. So it's extremely specific. And that probably is not the end of this. We will have more information to go by and to make it more specific. This is extremely specific. ICD-10. Go
Sorry,
ahead.
Professor. Yes, so in a situation like this, the initial contact for a person who has an accident on a boat or whatever would be the first responder. Do first responder agencies hire coders? Do they put in claims for insurances, or they just drop them off at the hospital and the hospital
No,
takes
they
care of
do.
that?
No, they have everything that they do is charged. They don't do it for the goodness of the heart. No, everything is charged. Every single thing is charged.
Okay, thank you.
For example, if something happens to you and you call the ambulance ride is gonna cost you something. Someone's gonna pay for that ambulance ride. Someone has to pay for that ambulance ride. So it's not like, yeah, they do whatever they have to do, and then again, like I said, out of the goodness of their heart, no, everything is charged. You might get a bill from the ambulance ride, and all those information are gonna be there. So they do have billing and coding.
Yes, you definitely get a bill from fire rescue.
No, right, but I've never had them ask for my insurance. Like when I've got,
well, it's a little bit different. Yeah. So so they do drop you at the hospital, and they can charge your insurance based on just getting the information from the hospital.
Okay, that makes sense. Thank you.
But remember, nothing is at the moment. Okay.
No, right.
So they rescue you, they take you here, there, whatever, they drop you at the hospital, and then someone goes back and says, okay, what was the final diagnosis? What happened to the patient? Yada yada yada. And then with that information, they bill their part. If it's something that is based on the state or the county or whatever, and it's kind of paid for because it's an emergency, then it goes to the insurance company. Insurance company pays, no problem, no nothing. But all of it is charged. When we talk about Medicare, I think that's the best example. When people have Medicare, and then they go into HMO, for example, the HMO promise, you know, all these things: vision, dental, the transportation, coffee, pastelito, croquetas in the clinic, all those things. All those things are charged. All those things they are paying. You are paying for them, and you could get all those things. They get all those things paid. So they charge Medicare. They charge someone pays for all those things. That makes sense? No?
Yeah, that makes sense. I'm just wondering
Okay.
también what's the pastelito code? You just haven't said that one.
I don't
I'm just
think
kidding.
I
I'm
don't
just
think
kidding.
the pastries,
I'm just
I don't
kidding.
think the pastries have a code, but I guarantee that there is a code for providing them food at the clinic. Okay, someone put up something in the chat. To my understanding, Ty says, to my understanding, they only bill for the transport. That's what they've been told. Okay. So if you call for rescue for a patient, and this is what happens, they go and the service that they are providing is the transportation. Okay. So let's go by that. So let's say it's an ambulance ride. So transportation, right? So transportation is the service, is the what? Okay. Now we need a y plus the y. So the y is whatever, fracture or something because of whatever happened, car accident. So was still saying, why are we doing the transportation? Well, why? Because the patient has a fracture because he was in a car accident. What we did? Transportation. So we need the transportation part is simple. Transportation. It's a HCPCS code. Boom. It depends on what type of ambulance. It depends on if it's in-state, out-of-state. It could be per mile. It could be air rescue. It could be a plane. It could be a helicopter. It could be a car. It could be a taxi. It could transportation. What? Why? And then we describe why. What happened. So all of it is billed or charged. Now you got me thinking. I need to figure out what the pastries, how they charge the pastries in them. I'm pretty sure there's something. Do you know the Selena chart, the thing that you use for eyesight? So whenever they put you and say they put you 20
Yeah,
feet
the
from
eye
the
chart.
wall, and they go like cover one eye, tell me what you see here. So to do that exam, if I'm not mistaken, it's around $25. So a doctor can charge you around $25 or charge your insurance around $25 to check your eyesight with a poster on the wall from 1975. So everything is charged, people. Everything is charged. And don't get mad at that, because if you work by percentage, and let's say you get a 10% of whatever money comes back to the office, then those $20 or those whatever, let's say $25 for that eye exam that takes 10 seconds, you get $5 from it, or you get $2.50 from it. Depends. So everything has to be charged, people. Everything has to be charged. Now, basic steps to do this is figure out the term. The term will be the question. So the way that we are gonna do it, I'm gonna say, okay, here's your. So I'm gonna say your code is, or your term is STEN. Go. Look for it. So when that happens, that's my main term. You check for subterms, qualifiers, whatever it is, and you go in the index. So this is why it says trust the index. Immediately, when I give you a code, I want you to identify what it is. Is it a diagnosis? Is it a procedure? Or is it a supply? When you determine which one it is, you will be able to determine which book you're going to use. At the beginning, we will say we're going to only do diagnosis. All of them are going to be in the same book, ICD-10-CM. When we're practicing for CPTs, we're going to say all of them are CPTs. And we're going to look for CPTs. When we're practicing all the books combined, I want you to determine what is the first and then what book to do it. And then from there, you have to look for the index. The index for each book is in different places. That's kind of annoying, but some are in the front, some are at the end of the book. So you need to know which book you are using and where the index is in each one. Other than that, the steps are fairly simple. Get the information from the index and go to the sections and determine what the code is. And in our case, will be posted in the chat to see if you did it correctly or not. So here's the word chronological order. So we start with the letters, and then from letters to numbers. There's 22 chapters based on the body systems or conditions. So conditions, for example, cancer is section or chapter C. They are organized with major topic headings, categories, subcategories, and codes. And then sometimes we have a 7-character. It will tell you how. So I'll show you how that one works. And sometimes you have a placeholder. That's the little X that we have to hold a spot. So this is, again, you will not remember this later, but so let's say I have a code. This is made up code 00.1, and then I need a 7-character. Okay, so that's 4, 5, 6, 7. The 7-character, let's say, is an A. Okay, so that A can only go in the 7th spot because it's an A, and the rules are that the last the 7-character has to be a letter and has to go there. Okay, so if I put a 0.1 and then I put my A next to it, the A is in the 1, 2, 3, 4, 5 spot, but it goes in the 7th. Okay, so the only way that I can do that is if I put 2 placeholders, 2 X's, holding the spots, so we could put the A in the 7th spot. So that's something that takes a while to understand. So when we're doing the practices, you will see the book tells you when you need a 7-character, when you need a placeholder, like all of it. So you need to read and understand the little descriptions and things that are around the codes. So you will see that when we're practicing. The hardest ones are fractures. Most of the fractures have placeholders and 7 characters. So when we practice ICD-10, we're going to practice ICD-10 by itself. And then one day we're going to only practice fractures. So next week will be CPT, the week after the CPT and HCPCS. The week after that, hopefully you will have your books, and we will do ICD one day and then fractures the next day. So that's around the next 2 weeks. So this is an example of a page from the book, or 2 pages from the book. This is chapter 16, certain conditions of perinatal period. Sometimes they match, so perinatal P, sometimes they don't. Cancer C. There's a bunch of them that don't make any sense. So these are the codes that we have, P00 all the way to P96. So not all the codes are there. Not every number is used. This is an example here. So this is P07.3, preterm newborn. Now that code says only preterm or premature newborn. And then here on the bottom, you have P07.30. So So we added a number to the previous one, and P07.30 means preterm, newborn, unspecified weeks of gestation. So we don't know how many weeks. But if you knew the weeks, you could use P07.31 because this one says preterm newborn gestational age at least 28 completed weeks. And then on the bottom tells you what is 28. So 28 weeks is 28 weeks, 0 days to 28 weeks, 6 days. And again, all of that information is going to be given to you in the question or in the term. You just have to match it with what it has. So if I say preterm newborn 28 weeks, you look for that in the index. The index will take you to here to P703. You go to the section, look for P073, and then go here, read them, and pick the one that matches what you have in the question. Should work. This is an example of poisoning. So poisoning is the T's, poisoning or toxic effect. So T for toxic in this case. So T36 is poisoning with antibiotics. And then, so you pick what the antibiotic is or what it is. In this case, it's penicillin. So you go from here to here to here to here, and then you decide what was it, self-harm, assault, whatever, and you pick the one that matches what you decided. You're gonna get this from the table. The table is the easiest way. Go to the section and then determine which one the correct one is. This is another chapter. This is chapter 21. You see that we're getting to the C's. And this is, again, C00 to C99. Again, not all the codes are going to be used. This is a few examples. And then why are you in the hospital? Why are you with the doctor? So super simple, straight to the point, following the index, and you should get it right. So this is a perfect example of one. We're going to do it here together. So this one says, which code is assigned for mechanical breakdown? There you go. Okay. Mechanical breakdown, left carotid arterial graft, initial encounter. Okay. So we already got to this section, mechanical breakdown of vascular grafts. That is T82.3. So you went to mechanical breakdown in the index, and it took you here. Okay. So now you have to determine which one is it. So the next one says mechanical breakdown, aortic bifurcation graft replacement. So now you go, okay, let's see. So we are here. Okay. So I have mechanical breakdown. Yes. I have aortic bifurcation graft. Okay. So aortic bifurcation graft, or in, like arterial graft. So arterial graft. And now you still have left carotid, and then you have initial encounter to go. So now we go, okay, so mechanical breakdown of aortic bifurcation graft. So let's go here. This one, the first one says breakdown of mechanical aortic bifurcation graft. Well, it's not aortic, it's carotid, so that's not the one. This one says breakdown mechanical of carotid arterial graft. Okay, perfect. Bypass graft. This one says femoral. This is not. This one says other. No, this one says unspecified. No, it's specified in the carotid one. Okay. So we have everything. So left carotid is not there. The last thing that we're missing is initial encounter. So now we go to initial encounter. So right now our code is T82311, right? And then we're missing a 7 character. So the 7 character is going to be from this list. Okay. At the end, and the 7 character, you're going to put an A, a D, or an S, depending on what it is. Ours is initial encounter. You select letter A. Our code is T82.31A. And that's how you want to do it. Again, I don't expect you to memorize this today, but that's how we do it. This is a page on your book. Okay, this is a page from your book. You look for mechanical breakdown, so I'll take you here. For mechanical breakdown, you go like graph vascular graft is going to take you here. And from there, you're going to look for the carotid. We're going to take you here. And then we're going to do initial encounter, or the last thing is going to take you here. Again, this is one of the hardest ones. I don't know why they put this as the first example, but we're going to do this. When we do this, we're going to do kind of the same thing as we did with the math. We're going to do, 3, 4, each one of you guys. We're going to do around 30 or 40 every time we practice, or every single book. So by the end of all the practices, you should have done over 200 codes from all the books. So CMS is the one that decides how we submit things. You don't need to know how to submit things yet. You just need to know that CMS is the one that puts all the guidelines. Encounter is a face-to-face, or where someone gets with the providers, or a patient and a provider get together in any way. It could be over the phone, it could be in the face-to-face, it could be through videos, whatever it is. And then the provider is going to be the individual that gives the service, the one that renders the service, the one that can bill for that service. So you need to know those two definitions: encounter and provider. So the sections are the sections of the books. For the ICD, we have section 1 is the coding guidelines and the specific guidelines for chapters. Section 2 is for principal diagnosis. Section 3 is for additional diagnosis. Section 4 is for diagnostic coding for outpatient services, and appendix for personal admission reporting guidance. So from here, the things that I want you to pay attention is these two. There's a thing called principal. Okay. Diagnosis. Why does it look so weird? Principal diagnosis. And principal diagnosis is the concept of what is the most important thing that's happening. Okay. So if a patient has a broken leg, so has a fracture, okay, has a heart attack, and has the flu, which one is the principal diagnosis? Well, it depends which one is affecting the patient the most at the moment of looking at the patient. So if the patient has a fracture from today, he has a heart attack from last month, and he is getting over the flu from 2 weeks ago, the most important one is a fracture. The principal will be the fracture. But if the patient has a fracture from 8 months ago, or 2 months ago, is healing, had a heart attack today, and had the flu 2 weeks ago, the most important will be the heart attack. If the patient had a fracture 3 weeks ago because he had a heart attack 6 months ago, and has the flu today, and he's coughing, not able to breathe, and about to die, then the flu is the most important one, the principal. Okay. So we are going to do definitions of principal and primary, the difference between principal and primary diagnosis when we talk about inpatient and outpatient. So take that into account. And this one that is called present on admission, or present on admission, POA. That means that the patient got there with it. So if a patient goes to a hospital and there's a present admission diagnosis, that means that the patient brought that from home. They didn't got it at the hospital. So if you get to the hospital with a fracture and the flu, okay, and the flu was present on admission, you can now say that the patient got the flu at the hospital. Okay, if the flu was not present on admission, so the patient went for a fracture and came out with still the fracture and the flu, so they got it at the hospital. So that's why that is so important. So that's some things that I don't know before a later time, but I'm just letting you know a little bit in advance. There's a few things that you need to know. It's what we call them the coding conventions. or things that you should, kind of make sure that you know. There's an alphabetic index and a tabular list. There's a specific format that we're going to use whenever you see it. There's codes for reporting purposes only. We have the placeholder or the X. Some will have 7 characters, abbreviations, punctuation, and other unspecified codes are going to be included in the descriptions. Some codes are going to say includes. So it's going to have a note that says includes all of this code, all of these terms. Some are going to have other terms that are included. They're going to have excludes note. So it might say something like, for example, diabetes. We'll say, for example, exclude gestational diabetes. So it's not the same to be pregnant and with diabetes or have diabetes because of pregnancy. So you'll see something that says includes or excludes. Etiology is what causes the problem. So some information will be there. There's words that we use and or with. So diabetes and pregnancy is different from pregnancy with diabetes or because of diabetes. Cross-reference is always there. They will tell you to go somewhere else. Code also. So if you have something that needs 2 codes, it will tell you code also. Default code is a code that starts with only 3 letters. So the 3 characters. So if I have a code that says I10, for example, so that is the default code. If I have a code that says I10, 1, 2, 3, the default code is the first 3 characters. So that will come in handy when we're doing the 7 character or the placeholders. It will tell you to go to the default code. It's the first 3 characters. And then at the end, you have some clinical criteria for that. So all of that information is found here. You see, this node is an instructional node. This one says include, so it's an include node. This one says excludes, so what is not included. And again, descriptions, subcategories, excludes again. Okay, placeholders. So placeholders will be X, 7 character. This pink box here. Again, when we're practicing, that will make a lot more sense. And we're getting close to that, Vivo. Hopefully next week, between next week and the next week, you have your books. This is an example of a question from your book. I like to, this is the diagnosis of the patient. Alcoholism with that name, with dependence. Okay, so that word by itself, it's what would you look for because it has a name. Whenever it has a name, I will use with that name. But you can start with alcoholism if you want it, and then go there. So in this example, they did alcoholism first. Okay. And this alcoholism is this code. And then because it says with dependence, then they look for this one later. And then they look for this word now. So Korsakoff's, so now Korsakoff's. And then under Korsakoff, they went with dependence. So the code at the end is that one. Okay. So there's many ways that you can look for it. They did this first, then this second, this third. Okay. So they went alcoholism, then that one, then that one. I will have done it differently. I will go with this one first, and I will get right here. So that one, I will be done. But I'll show you how to do that when you're practicing. There's just knowing a lot of things. Okay. This is not for you. Okay, so after we've covered the chapter, you should know a little bit about ICD-10 and the terms related to it. ICD-10, ICD, International Classification of Disease, 10 Prevention, CM, Clinical Modifications. PCS is for procedure coding. We need to know that the book is divided into sections, into an index, and then we're gonna use 7 characters. Encounter is when a patient sees a doctor in any way. The provider is the one that provides the service or bills for it. Each one is going to be a little bit different to do depending on the specific medical necessity. Nothing that we've talked today has to do with money. It is it needs to be there for payment, but payment is not related to this. So maybe if I do it like this, let me do one of this one real quick. I think I've done this before with you guys, but I'm not sure. But let's see. So we have visits, okay? So we have the what and we have the why. We have the what plus the why, we have money. Okay? The what is a CPT or a procedure. And the why is going to be the ICD, NCM, or a diagnosis, right? So all of that is the same, right? Now, if my procedure is a 99-213, and they only say that the patient has a fracture. Let's say 99-213 is $100. If I have the same 99-213, and now instead of a fracture, I have pregnancy as a diagnosis, still it's going to be $100. If I have a 99-213, and I have I don't know, healthy baby, it's going to be $100. If I have let me see, can I write it here? I think I can. If I have a 99-213 and ST elevation, myocardial infarction, a heart attack, still it's gonna be $100 because those $100 are linked to that. Okay, that is what's worth $100. The visit using a 99-213 code. The fracture, the pregnancy, the healthy baby, the ST elevation, myocardial infarction, heart attack have to accompany the procedure code, but will not affect the price of that code. If you use that code is worth $100. So diagnosis accompanies the procedure and proves or provides medical necessity for payment for the fee that the procedure is going to be paid for. If we change a little bit and we say, instead of a 99, maybe this up here, I don't like it. Well, let's do it like this now. Now we go Blackboard. Now if I say I have, it would be nice if you like white. I have the same fracture. I have the pregnancy. I have the healthy baby. And I have a heart attack. Okay. And instead of a 99-213, I use a 99-214, for example. That is a more involved code. Instead of 100, it's going to be 200. I can use the same all the way down. Everyone using 99-214, everyone's going to get paid exactly the same. $200. because what changes the price is not the procedure. I mean, the diagnosis is the procedure. So if the procedure is the same, the price or the fee is going to be the same, regardless of which one diagnosis you're using. Is that clear? All right, we understanding this.
Yes, sir.
This is one of the hardest things to understand because you go like, well, a fracture and a pregnancy and a heart attack and a healthy baby are completely different things. Yeah. But if you use that code, 99214, that's the price. That's the fee. Hey people, this again, this is I'm going for things that are a little bit later on, but questions, my people. Any questions on anything that we did today? Any questions on what we did today?
You said the books might be coming within the next couple weeks. What would that look like? Do we have to go to Miami-Dade to pick them up?
Yes, ma'am. They will contact you as soon as the books are there. And whenever the books are there, you have to go to the campus with an ID to pick them up. You have to go to the continuing education department.
Thank
So they'll
you.
give you the instructions on how to do it.
Okay.
After they say that the books are ready and available, you have to, for the purpose of my class, I'll give you a week to go pick them up. So after a week, we're gonna start using the books. So let's say on Monday they say, oh, the books are ready. Then you have until not this week, you have until the week after that to get. So we're gonna start. So let's say on Monday they say that the books are there, or next week any day they say that the books are there. The books are there. The week after we're gonna start using them. So I want to make sure to give you a chance to go get them, but also we're not behind in time or anything. But I want to make sure that we don't waste time. When the books are just to practice. As soon as we all or most of you have them, we can start using them. There's not a lot of that you can do without the book if we're practicing. So I will just ask you guys, everyone has it. If everyone has it, as soon as we can, we're going to start using them. Not that it has to be on the next week or the week after that. It's whenever everyone has it. As soon as they let you know that they're available, start picking them up, and then and I'll just I'll keep asking. You have them? Okay, we're gonna use them now. We're waiting on half of you to get it. Well, we'll use it. We'll use them the week after that, but not more than 2 weeks after the books are available, because I'm not gonna hold the class because you don't have your books if the books are available. So a week after they say that they're available should be good.
I have a question.
Go ahead.
I know I asked it in the past about the book that we're going through now, the Michelle Green, Understanding the Health Insurance. I know you said we're gonna have access to it virtual, but I did ask how can I get like my hands on the copy, like a physical book?
That's we do not provide a physical copy of it. That you have to contact them and see if, but then for that you need the code first to see if, because you paid for a code already, there's a way that they can send you a copy. So whenever your books are ready, they're gonna give you a code to redeem the book online, and then you can just contact Cengage and say, hey, I have a virtual copy, not of my liking. Can I get a copy? Can I get a physical copy? and they could. I'm not sure if they would, but they should give you instructions on how to get a hold of one. Maybe I will think at a discounted price because you already have the virtual one, and maybe even free. I'm not sure. That I've never had that conversation with them, so it's kind of hard to see what they will decide.
Okay, no worries. I'll look into it. Thank you.
As soon as you get the codes, I will say as soon as you get the code for the book, immediately contact them, contact support with them, and say, hey, I have this. I already got my code. I mean, you still have to enter the code because we're gonna do things online, but can I get a hard copy? Maybe that's I think that will be the route. Because if you do it now, they're gonna go, okay, so yeah, pay $200 and I'll send you a copy of it. Okay, what if I already pay $200 for the code? I don't know what the code is, but the code is not cheap. The code is super expensive. Or not super expensive, but it's expensive. It's something. So because you have it, you know, maybe it should be better if you contact them.
Okay, and it comes with the one that we get online will also come with the workbook. So
yeah, everything is virtual. It's going to be added to the class. So everything's going to be in the class. So
okay.
all the things that are part of the workbook are going to be in the class.
Okay, gotcha. All right, thank
Quizzes, everything.
you. Thank you.
No problem. Okay, so it's 10 of you again. So Brittany, Liz, Eva, Kathy, Marjorie, Amy, Christine, Nadas. Shit. 1, 2, 3. 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Today's Saturday 12. Excellent. Okay. So what I'm gonna do now is while you guys go and enjoy your weekend, I going to